Hey everyone. As a neurologist who's spent years working with both kids and adults, I know firsthand just how exhausting and honestly how isolating it can be to navigate neurodivergence within your own home. So today, we aren't just going to list off symptoms in a vacuum. Instead, we're doing a full clinical explainer, really diving into how we can heal and balance the family dynamics affected by ADHD. We're going to look at the patient not just as some isolated individual, but as a vital, deeply interconnected part of your entire family system.
So, here is our treatment plan for today's analysis. 1. Biology versus societal expectations. 2. The black sheep dynamic. 3. Neurodiverse communication. 4. Strategies for reducing conflict. And 5. The journey to adulthood.
Okay, let's dive right into part 1, biology versus societal expectations. To truly help a child with ADHD, we have to establish what we're actually dealing with, right? We need to strip away all those common misconceptions and look at the clinical and historical reality of the condition. So to understand ADHD accurately, we really have to view it through 4 converging pillars. First, it's a disorder, because yes, it causes real, measurable suffering and functional impairment. But it's also a difference. It's a variation in human cognition that isn't always a disadvantage. Third, it exists on a spectrum, meaning it's not just a simple on and off switch. And finally, and I find this absolutely fascinating, it's a human adaptation, meaning these very traits actually provided survival advantages in our evolutionary past. If we reduce ADHD to just a disorder that needs to be cured, or, flip side, just some magical gift to be celebrated, we literally amputate the reality of the patient's lived experience. It has to be viewed integratively.
And this brings us to the root of so much frustration in your household. Your child's biological traits, things like natural cognitive variation, physical restlessness, impulsivity, well, they were designed for a very different world. But today, they're forced to clash fiercely with modern societal demands. I mean, sitting perfectly still for 8 hours at school, adhering to hyper-rigid schedules, sustaining long-term attention on things that just aren't stimulating, it's a lot. If you're struggling to reconcile your child's behavior with what the world expects of them, I want you to know your struggle is incredibly valid. It is a profound, fundamental mismatch between human biology and modern expectations.
Moving right along to section 2, the black sheep dynamic.
Now, what's really interesting here is that this biological mismatch doesn't just stay at school, it comes right home. And that brings us to the hidden emotional architecture of the family system. Before successful treatment, a family's dynamic often subconsciously organizes around the patient as the black sheep. The attention, the blame, the endless worry, it all just zeroes in on the child with ADHD. Unconsciously, the whole family's stability relies on this setup. Everyone else gets a free pass to ignore their own issues because, hey, they're so focused on the one causing the daily chaos. But when that child is treated and begins to recover, they stop being the black sheep and suddenly become the mirror. And wow, the rest of the family now has to look at their own untreated issues, their own unmet obligations, and their own interpersonal conflicts. There is this incredibly powerful idea in the clinical literature that sums this up perfectly. Stability is bought at the cost of the patient's identity. The one who started fires now puts them out. It's a profound realization, isn't it? Successfully treating the child can actually disrupt your family's system at first, simply because the convenient scapegoat is suddenly gone. The family has to do the hard work of rebuilding a healthier foundation that doesn't rely on blaming misunderstood behaviors.
Which leads us perfectly into section 3, fostering neurodiverse communication.
So how exactly do we rebuild that healthier foundation? Well, we have to fundamentally shift the way we talk and relate to one another. This is where the neurodiversity framework becomes a total game changer for your home. Now, true neurodiversity doesn't mean ignoring the child's struggles or toxic positivity where we pretend everything is just fine. It means shifting our mindset. We move away from we need to fix this broken child and move toward how can we adapt the environment to actually support this child. It asks us to completely accept the biological reality of the condition while providing the accommodations necessary to ease their impairment. It literally changes the entire tone of your daily communication from constant criticism to collaborative problem solving.
All right, section 4, strategies for reducing conflict. Understanding the theory is great and all, but let's get into the actionable clinical tips of our treatment plan so you can start de-escalating things today. Think of the family as an ecosystem with bidirectional influences. The child with ADHD might be at the center, sure, but they are constantly affecting and being affected by parents, siblings, the extended family, the whole domestic environment.
When conflict erupts, it's never just the child's isolated symptom. It's a chain reaction. A sibling gets resentful, a parent reacts with sharp frustration, stress levels shoot through the roof, and guess what? The child's symptoms actually worsen in response to that stress. Effective treatment simply has to address this whole interconnected web.
So, how do we intervene in that web? Let's break it down. First, reframe the behavior. What looks like stubborn, calculated defiance is so often just a highly overwhelmed executive function. They aren't plotting against you, they literally just forgot where they put their shoes. Second, you have to intentionally manufacture positive interactions. The constant daily cycle of correction really erodes warmth over time, so you must actively rebuild it. Third, address the broader family stress. Check in with the siblings who might be feeling invisible, and please protect your own partnership from the strain. And lastly, and this is absolutely crucial, consider intergenerational ADHD. Because this condition is highly heritable, we frequently find that a parent has undiagnosed ADHD themselves, which heavily compromises their ability to provide the structured environment the kid needs. I can't stress this enough. Effective treatment is a family-wide endeavor.
And finally, Section 5, the journey to adulthood. All of this exhausting, hard work you're putting in during the early years, it isn't just about surviving Tuesday night homework. It's about preparing your child for the incredibly complex transition into independence. The clinical data shows us that the journey to adulthood is a profound vulnerability zone. We typically look at this in 4 stages, starting from late adolescence, where we slowly begin shifting responsibility, all the way up to established adult care in their 20s. But here is the critical clinical reality, and I really want you to hear this loud and clear. During this transition, nearly 50% of patients drop out of treatment if it isn't deliberately, carefully structured. 50%. They leave home, they lose that parental scaffolding that kept them organized, and they just stop managing their care. Your role has to gradually shift from being the manager of their life to more of a consultant, intentionally building up their self-advocacy.
Let's look at how this planning builds into real-world success. Deliberate transition planning from pediatric to adult care causes continuity of care to absolutely skyrocket. And hand in hand with that is the absolute necessity of post-secondary accommodations. Things like extended test time, quiet testing environments, or maybe a reduced course load. These are not shortcuts, okay? They are essential environmental adaptations. Using these accommodations creates a massive, tangible benefit in college retention and successful adult adaptation. Your child's long-term success is built squarely on these structured support.
As we wrap up this explainer, I want to leave you with one final provocative thought to mull over. If we recognize that ADHD is, at its core, a biological difference struggling against a highly rigid modern world, we really must change our approach. Instead of exhausting yourselves and your child by endlessly trying to force them into an environment that just wasn't built for their brain, how can you radically rethink your daily household dynamics to fit them? Embrace their neurodiversity, adjust your family's expectations, and walk forward with a renewed, empathetic, and united strategy. Thank you so much for joining me today.